Next up, we have Valentina Faria, an EAB student since the age of 3. She will tackle the stereotypes around mental health and challenge us to think differently about people with mental disorders, aiming to inspire greater empathy and inclusivity. Please join me in welcoming Valentina Faria to the stage.
Mental health has become a very popular term in the last few years. It has appeared everywhere, in social media, in schools, and even in casual conversations. According to the World Health Organization, the promotion of mental health and prevention interventions aim to strengthen people's capacity to regulate their emotions, enhance alternative to risk-taking behaviors, and build resilience for managing difficult situations, and promote supportive environments and social networks. And yet, according to an article published in 2020 in the journal Child and Adolescent Psychiatry and Mental Health, mental disorders are often underdiagnosed and undertreated in young people, a situation likely to increase the severity of the disorders and associated risks. And with all this attention, misconceptions have emerged. Misunderstandings and stereotypes endorsed by the general population lead to stigmatization. Stigma and discrimination can be shown in various ways. According to the Alcohol and Drug Foundation, there are multiple types of stigma. Public stigma is when stereotypes and prejudice endorsed by society at large. Example is to think of someone who is dealing with depression. When they finally open up about their feelings, they might get hit with, everyone feels down sometimes. Just snap out of it. Society often talks about mental health like they're no big deal, or worse, that mental disorders are a sign of weakness. This makes people feel embarrassed to ask for help because they don't want others to perceive them as too sensitive or dramatic. Another example is that, according to PubMed, 87% of adults with ASD, or autism spectrum disorder, are unemployed due to the lack of confidence in societal views on autistic people. Structural stigma is when laws, policies, and institutions reinforce discrimination. In some places, mental health treatment isn't even covered by insurance the way physical health is. So imagine someone is dealing with anxiety, but they cannot afford therapy because insurance won't help cover it. In the United States, for example, mental health coverage can vary widely depending on the state, the insurance provider, and the specific plan. Not all plans fully cover it. Self-stigma occurs when people internalize the feeling and shame and lack of self-worth. Now, thinking about a teenager with bipolar disorder, when they hear all types of negative things coming from people, they start thinking, maybe I'm too much to handle. Maybe I can't keep up with school or have good relationships. They start believing these stereotypes, which makes them feel ashamed and afraid to reach out for help, even though they need it. I have felt that. Before getting diagnosed with ASD and OCD, all these stigmatizations and stereotypes of not being able to maintain relationships started to get in my head. I started to feel confused, and I did not ask for help after a long time. These stigmas create barriers, preventing people from seeking help and accessing proper treatment. With all this information, a question comes up. How does stigma associated with mental health affect people? According to data from Health Direct, a person who is stigmatized may be treated differently and excluded from many things the rest of society takes for granted. They might be labeled for their illness and most likely to face discrimination. Being treated differently often increases the feelings of isolation, suicidal thoughts, and low self-esteem. This can lead to being unable to seek treatment and leading to alcohol or drug abuse. From this, we can infer that stigma causes a significant amount of issues regarding someone who has mental illness. But things don't have to be this way. We can all do something to change this reality. Support others. Even a simple word of encouragement can make a difference. Schools and parents have a huge role to play in young people's diagnosis and identification of early signs of mental illness. According to the National Library of Medicine, early identification and proper diagnosis may prevent the chronicity of some disorders, accumulation of adverse events, and even suicide, which is the leading cause of death for 15 and 25-year-olds. A personal story now. Before getting diagnosed with ASD, I just thought I was an annoying kid who could not partake in social activities. However, after my diagnosis, I'm an annoying kid who cannot partake in social activities for a reason. Before getting therapy treatments, I thought what is called OCD was just being me abnormally strict with things. Formal diagnosis helped professionals and my mother to understand me, and for me to understand myself. It made me feel much better and helped me seek the proper treatment. It was scary to ask for help and weird to ask people and to tell people how I felt. But all I needed was a person in which I could trust. Parents should let their kids talk about their feelings and listen to them. Don't judge them. Don't say, that can't be true. You're so happy. Instead, look for ways to support them, therapy or even hobbies. An example of something that helped me was theater and arts. My mom has always been my biggest supporter, and when dealing with depression, my mother did not back down for a second to help me. It was scary talking about my feelings, but with her, I felt safe. That is the feeling you should teach your children. Help them feel safe and supported. Parents are not the only ones that can help, but also teachers, colleagues, and friends. My other biggest supporters were friends who did not fail to make me feel accepted and appreciated. And trusted adults at school are definitely not missing. Dr. Speranjo helped me by listening, Mr. Schultz with his amazing theater classes, and Ms. Priya and Ms. Burden with their words of encouragement. To summarize, if you know someone is not feeling well, it doesn't take much to help them feel safe and trusted. We need compassion, empathy, courage, and commitment to break discrimination. Together, we can build a community where mental health care is treated with the same respect and importance as physical health. Thank you.